Bismillahirrahmanirrahim. Today I am going to discuss physiological changes during pregnancy. Response of mother body to pregnancy. Reaction of the mother to fetus and hormone is the increase in size of various sexual organs. Uterus increase from about 50 grams to 1100 grams. Breast approximately double in size. Vagina enlarge and the introitus open more widely. Hormone cause marked change in a pregnant woman appearance, sometimes resulting in the development of edema, acne, masculine or acromegalic feature. Weight gain during pregnancy. Total weight gain is 24 pounds. Fetus weight is 7 pounds. Amniotic fluid gain is 4 pounds. Uterus 2 pounds. Breast 2 pounds. And extra fluid in the blood and extracellular fluid 6 pounds. Fat accumulation 3 pounds. Changes in eating habits. During pregnancy, a great increased desire for food, partly as a result of removal of food substances from the mother body by the fetus and partly because of hormonal factors. Without appropriate parental control of diet, the mother's weight gain can be as greater as 75 pounds instead of the usual 24 pounds. Metabolism during pregnancy. Increased secretion of thyroxine, adrenocortical hormone, and the sex hormone. The basal metabolic rate of the pregnant woman increase about 15% during lateral half of pregnancy. As a result, she frequently has sensation of becoming overheated. Nutrition during pregnancy. Greatest growth of the fetus occurs during the last trimester of pregnancy. Its weights almost double during the last 2 months of pregnancy. The mother does not absorb sufficient protein, calcium, phosphate, and iron from her diet during the last month of pregnancy to supply the extra need of the fetus. However, anticipating these extra needs, the mother body has already been storing these substances, some in the placenta but most in the normal storage depots of the mother. Nutrition during pregnancy. If appropriate nutritional elements are not present in pregnant woman's diet, a number of maternal deficiency can occur, especially in calcium, phosphate, iron, and the vitamins. About 375 mg of iron is needed by the fetus to form its blood, and an additional 600 mg is needed by the mother to form her own extra blood. The normal store of non-hemoglobin iron in the mother at the outset of pregnancy is often only 100 mg and almost never more than 700 mg. Therefore, without sufficient iron in her food, a pregnant woman usually develops hypochromic anemia. Also, it is especially important that she receive vitamin D because although the total quantity of calcium used by the fetus is small, calcium is normally poorly absorbed by the mother's gastrointestinal tract without vitamin D. Finally, short before birth of the baby, vitamin K is often added to mother diet so that the baby will have sufficient prothrombin to prevent hemorrhage, particularly brain hemorrhage caused by birth process. Cardiac output during pregnancy. About 625 milliliter of blood flow through the maternal circulation of the placenta each minute during the last month of pregnancy. This plus general increase in the mother metabolism increase the mother cardiac output to 300 to 4 up to 30 to 40% above normal 27th week of pregnancy. Blood volume during pregnancy. The maternal blood volume short before term is about 30% above normal. The cause of the increased volume is due to aldosterone and estrogen, which are greatly increased in pregnancy and to increase fluid retention by the kidney. Also, the bone marrow become increasingly increasingly active and produce extra red blood cell to go with the excess fluid volume. Therefore, at the time of birth of the baby, the mother has about 1 to 2 liters of extra blood in her circulatory system. Only about 1/4 of this amount is normally lost through bleeding, thereby allowing considerably safety factor for the mother during delivery of the baby. We know that there is 5 liters of blood in normal 70 kg body weight person, but in pregnant woman this increase up to 6 liters. Maternal respiration during pregnancy. The total amount of oxygen used shortly before birth of the baby is about 20% above normal, and a commensurate amount of carbon dioxide is formed. These effects cause the mother minute ventilation to increase. It is also believed that the high level of progesterone during pregnancy increases the minute ventilation even more because progesterone increases the respiratory center sensitivity to carbon dioxide. The net result is an increase in the minute ventilation of about 50% and decrease in arterial carbon dioxide partial pressure to several milliliters of mercury below that in a non-pregnant woman. Simultaneously, the growing uterus press upward against the abdominal content and thus press upward against the diaphragm. Total excursion of the diaphragm is decreased. Consequently, the respiratory rate is increased to maintain the extra ventilation. Function of the maternal urinary system. During pregnancy, the rate of urine formation by a pregnant woman is usually slightly increased because of increased fluid intake and increased load of excretory products. The renal tubule reabsorptive capacity of sodium chloride and water is increased as much as 50% as a consequence of increased production of steroid hormone by the placenta and adrenal cortex. The glomerular filtrate rate increase much as 50% during pregnancy, which tend to increase the rate of water and electrolyte excretion in the urine. When all these effects are considered, the normal pregnant woman accumulate only about 6 pounds of extra water and salt. Thank you. See you in the